The whole idea behind transgender medicine and starting them young is essentially to prevent suicides when they get older. So if, little Lisa feels like she's a boy, well, let's block her puberty, pump her up with hormones, do surgery before she goes through puberty, because if we don't do that, she may commit suicide. That's the general gist of it, and that is not well-founded. Now, what do you think, Chris?
I'm very, very supportive of your opinion on this.
Of whose opinion?
On Mark's opinion.
That's right.
Yeah, I agree with Mark on this.
Yeah, thank you.
Number one, I think we need to, I don't understand the subject very well, but I'm just using common sense, okay? I think that the problem is not well understood.
Mm-hmm.
The underpinnings of what causes gender dysphoria, which is a sense of I am in the wrong body, has, like Jocelyn said, a lot of psychological aspects, some physical aspects as well. And I think trying to use medicine to solve genetic and psychological problems has always been very problematic. Like, we don't get the result that we want. Second thing is, I think that there are bigger problems that these kids have that needs to be addressed foundationally. I don't think a young child is matured enough to really understand the implications of the treatment that we're offering them. There's so many questions in my mind, there's so many possibilities for bad outcomes that I just don't think it's a good idea at this point.
I'm going to bring Nick into this discussion. So we were just talking about the treatment. So one of the treatments is, and I see some children and adolescents, but one of the treatments is removal of breast tissue for those for women who want to look more masculine. And I know that that's usually something that plastic surgeons do.
Right.
Is that something that you do? And it's a personal decision. What's the youngest person that you would feel comfortable doing that on?
So I do some gender affirming surgeries, but not on kids. I don't think it would be fair to do something that's permanent for a child. Even as an adult, the way I feel today isn't the way that I'm gonna feel maybe 5 years from now. Marriages. The person that you marry 10 years ago isn't gonna be the same person 2 years, or 5 years. And so as a child, I just don't feel like they have enough, they really can't give informed consent. If they're an adult, that's a whole different scenario. And even with adults, with these gender affirming surgeries, even after they've had the surgeries, they have a high suicidal rate.
Right. What Nick said was important because it's going to segue into what we're about to discuss. But informed consent. So what that means is when you are consenting a patient for a procedure, they understand the risks, the benefits, and potential outcomes, right? So let's say when we talk to our patients about tying their tubes and no longer having babies, they need to fully understand, after this is done, you're not going to have any more babies unless you decide to go do in vitro fertilization. There we go.
Perfect.
All right.